Welcome to this Fit for Work webinar covering some of the key questions asked by employers. The rationale behind Fit for Work. Do I need to prepare for making Fit for Work referrals?
It is important to clarify what existing support you already have in place for employees on long-term sick leave. If you think that your company would benefit from including Fit for Work as part of your absence policy, one way to do this would be to consider building in a referral to Fit for Work once your employee reaches the 4-week absence mark. The CIPD has published guidelines helping to show you how to do this. These guidelines include things like consulting with staff representatives and piloting draft policies before implementing them. These policies can be found in the HR Resources section of the CIPD website. If you follow these guidelines and then decide to implement Fit for Work into your company's HR policy, it is advisable to let your staff know that you will be using the government service, perhaps via email, and direct them to the Fit for Work website, fitforwork.org, so that they can find out more information for themselves. You could also visit the website, fitforwork.org, and look at the Employer Toolkit, which is filled with useful information to help inform you about the service.
Why is there a need for Fit for Work?
Currently, according to a YouGov poll, only 31% of workers are able to access occupational health services. Fit for Work offers the whole adult working population access to high-quality occupational health guidance and assessments. Fit for Work was set up based on recommendations from Dame Carol Black and David Frost's 2011 independent review of sickness absence. This review was carried out to reduce the number of people moving needlessly away from work because of ill health, finding ways of improving the management of sickness absence in England and Wales, and to reduce the costs of sickness absence. Sickness absence is often unavoidable, but prolonged periods of sickness absence can have a negative impact on individuals and their families, employers, and our wider society. Fit for Work aims to minimise the loss of work resulting from ill health and to find ways of reducing the burdens and costs. The service is about empowering employers, giving them practical, useful advice and support, as well as managing the return to work process for employees on long-term sickness absence. Fit for Work can also help if you aren't sure how to approach employees on long-term sickness absence. Perhaps you might not be sure what is and isn't appropriate to ask your employees about their health or their prospective return to work. Fit for Work helps to act as a bridge between you and absent employees whilst clearly defining boundaries.
I'm an SME. Will Fit for Work help me?
The impact of long-term sickness absence on SMEs is far greater than on large companies. If a company with only 5 employees loses one of their employees for an extended period of time, the issues this causes will be amplified far more than if a 500-strong team loses a member. SMEs are also far less likely to have in-house occupational health provision than large employers, so for many, Fit for Work will mark the first time they have had access to such occupational health services. Some SMEs may outsource their occupational health, but for them, Fit for Work marks the first time they can access these services absolutely free. Without occupational health support, SMEs were previously beholden to an employee's fit note from their GP. So if a GP continuously signed an employee off work sick, there wasn't much the company could do. With Fit for Work, SMEs can now get involved in the return to work process earlier on and help support their employee back to work when they're ready to return, giving them more control in the process.
Why are Fit for Work referrals based on telephone assessments and not face-to-face interviews?
In the vast majority of cases, around 90%, assessments will be done over the telephone. The assessment is a holistic biopsychosocial assessment and will investigate all medical and non-medical obstacles preventing employees from returning to work, health, financial, emotional, etc. In more complex cases, it may be deemed necessary for a face-to-face assessment to take place. These will normally take place within 90 minutes travelling time by public transport from the employee's home address. The face-to-face interviews are primarily for people who have problems communicating. Research suggests that over-the-phone consultations can be as beneficial as face-to-face consultations. Fit for Work will endeavour to encourage self-help measures wherever these may have a positive impact.
What Fit for Work is and isn't. So, what is Fit for Work?
Fit for Work is a free scheme comprising two elements. Advice. Free, expert and impartial work-related health advice via the website fitforwork.org and free phone telephone line. And Fit for Work is a referral to an occupational health professional for employees who are on long-term sickness absence of 4 weeks or more. The Fit for Work occupational health professional will identify obstacles returning the employee from returning to work and produce a return to work plan tailored to the employee's needs. Referrals will often be made by GPs, but you will also be able to refer an employee if after 4 weeks' absence they have not been referred by their GP. Fit for Work is designed to work alongside and not replace existing occupational health services, but can be particularly beneficial for smaller organisations that may not have in-house occupational health provision for staff. Occupational health services can be extremely beneficial to companies, although their approach often tends to be more clinically focused. Fit for Work uses a biopsychosocial approach to occupational health, meaning that the service focuses on many different factors which may be preventing an employee's return to work alongside their health. This could include things like social and financial factors. If you already employ in-house occupational health professionals, they will know the company very well. They will understand how the company operates and have inside knowledge of the working environment and staff structure. So, if an employee is referred to Fit for Work from an organisation with existing in-house occupational health services, someone from the organisation's occupational health team could be a good point of contact for Fit for Work rather than their line manager, for example. Employers remain responsible for decisions on managing absence and paying statutory sick pay, and will now have access to better independent information when doing so. GPs will remain responsible for making decisions on day-to-day healthcare matters.
So what is Fit for Work not?
Fit for Work isn't linked to benefit entitlement or the work capability assessment. It's not about getting people off benefits and is not linked to any benefit entitlement or work capability assessments. Fit for Work is also not about forcing people back to work. It's there to support those who'd appreciate help with their return to work when off sick.
Making referrals to Fit for Work. How do I make a referral?
The referral service is quick and simple. Visit fitforwork.org/employer and select the Refer an Employee button. Enter your company details, these only need to be entered once, and information about the employee you would like to refer. Check the information and click Submit. To find out more and see a test referral in action, go to fitforwork.org/webinars and take a look at our webinar entitled Fit for Work, the Employer Referral Process Explained.
Is any training being offered to employers?
We are not offering employer training as such. However, we did run roadshows across England and Wales throughout autumn 2015 in association with ACAS in order to update employers about Fit for Work and on ways of managing sickness absence in their organisations. If you weren't able to attend a roadshow, there are still various options open to you. You may find the webinars on our website useful, as well as the resources in the Employer Toolkit. See the Employer page of the Fit for Work website. And you can contact our free phone advice line on 0800 032 6235 to speak to an advisor if you have any questions.
When might a referral to Fit for Work not be appropriate?
A referral for a Fit for Work assessment may not be suitable for individuals who, in the GP's clinical judgment, do not have a realistic prospect of returning to work, terminally ill patients, unless in the GP's clinical judgment a referral and return to work would be possible and beneficial for the patient, hospital inpatients, or patients in an acute phase of their medical condition.
How long does my employee need to be off sick before I can make a referral?
You can refer an employee if their GP has not done so after 4 weeks. A GP may refer a patient to Fit for Work before they have reached 4 weeks of sickness absence if they know that they will definitely be off work for longer than 4 weeks due to their health condition.
And why do I have to wait 4 weeks before referring an employee?
Research suggests that spells of absence of around 4 weeks in length present a significant risk of a more sustained absence, or the individual leaving employment altogether. Intervening at the 4-week mark can have beneficial outcomes for you and your employees. It also might not be possible to tell if a person is suffering from an acute or chronic illness before 4 weeks. However, if you suspect that employees might be off for 4 weeks or more, you could suggest that they speak to their GP about being referred.
What if my employee doesn't want to be referred to Fit for Work?
Referral to Fit for Work is entirely consent-based, so employees have to give their explicit consent before being referred to Fit for Work. We aren't able to speak to anyone who does not agree to a referral.
My employee is concerned about who will have access to the information they provide. What should I tell them?
The only people who will have access to this information will be case managers who will work with your employee on a return to work plan. Information will be treated as private and confidential, much like GP patient notes. All information will meet the Caldecott requirements. Employees may be asked for consent for their information to be used for evaluation and audit purposes. However, they can decline this.
The outcomes of a Fit for Work assessment. What will my employee receive?
Where an employee is judged by the Fit for Work occupational health professional to be able to return to work in some capacity, the culmination of the assessment will be a return to work plan outlining the ways in which he or she can return to work, often with modified duties or working hours. The return to work plan will include advice, recommendations for interventions, and signposting to other help for employees and you or their GP where necessary. The plan will also include a timetable for progressing interventions and for returning to work if appropriate. A return to work plan provides evidence of sickness absence in exactly the same way as a fit note issued by a GP, so the employee will not have to go to their GP for additional fit notes. The plan may indicate that a person is fit for work, not fit for work, or that he or she may be fit for work, subject to you being able to carry out the recommendations made in the plan, reasonable adjustments, for example. The return to work plan will be sent to the employee via email, through a secure web link, or by post. With their consent, it will be shared with their GP and with you so you can decide how to take action based on the recommendations.
What if I disagree with the advice given in an employee's return to work plan?
The return to work plan is produced for the employee and remains the property of the employee. All recommendations are for advisory purposes only. If you are unsure about proposals made in the return to work plan, you can liaise with the Fit for Work case manager to discuss it further.
What happens if my employee doesn't consent to sharing the outcome of an assessment?
A return to work plan will not be shared with an employee's GP or with you without their consent, so you will not receive any information from the service without the permission of the employee. Consent from an employee must be explicit, informed, specific, and freely given, and must be given at different parts of the process. For example, before they are referred to Fit for Work, before an assessment takes place where an employee is first contacted by Fit for Work following a referral, before any version of the return to work plan is shared, e.g. with their GP or with you, before Fit for Work contacts the individual's GP or employer or any third party if this is necessary as part of the assessment or follow-up. We believe the potential benefits will mean all parties will want to engage with Fit for Work and will actively manage sickness absence by following the advice in the return to work plan. However, if your employee doesn't consent to the outcome of the assessment being shared with you, you will not receive any information.
How long will my employee remain on the return to work plan?
The return to work plan will need to be reasonable for you and your employee. We expect that 60% of people will be one-touch patients, meaning that they will only need one phone call. We estimate that the majority of people will return to work within 4 to 6 weeks. However, this depends on the issues they are facing.
Not all problems can be tackled through changes to the work environment. What if interventions are necessary?
We anticipate that the majority of problems can be resolved through direct and open communication with employees and employers. Whilst Fit for Work is not based on offering interventions directly, there are a number of services, e.g. third sector services and charities, that have been credited by Fit for Work for the care they provide and may be suggested as potential sources of help for employees.
And what if the assessment recommends medical interventions? Who pays for them?
In some cases, a Fit for Work occupational health professional may recommend a medical treatment or intervention, e.g. counselling, physiotherapy, etc., to help an employee return to work after a period of absence. In this case, the Fit for Work professional would encourage you to fund these interventions. If you opt to do this, you can claim back the tax on expenditure of up to £500 per employee per year.
So, what now? If you want to find out more about Fit for Work, visit fitforwork.org/employer or call the free telephone advice line on 0800 032 6235. If you'd like to make a referral, visit fitforwork.org/employer and click on Refer an Employee. Thank you very much for listening.